Congressman Michael Burgess here. I represent a district in the northern part of Texas. I'm a physician. I practiced obstetrics and gynecology for 25 years back home in Texas. You know, we've heard a lot this summer about healthcare reform, seen a lot on our television shows about the famous town halls during the month of August. You know, the one thing I heard, the one thing I learned during the month of August is people are concerned when Congress takes on something this large. Now, it doesn't mean that there's not a problem, doesn't mean that there's not a reason for reform, but do we really have to turn the entire system on its head, a system that is working arguably for 60, 70, or 80% of the population? Do we have to turn that system on its head? And the answer is no. There are some things that do need to be fixed, and I'll tell you, one of the things I heard over and over and over again, what just drives people crazy, is an insurance company being able to deny someone coverage, or even worse yet, someone who's paid their bills all the way along and then has their coverage rescinded at the last minute when they get a tough medical diagnosis. That's wrong. Most people recognize that's wrong, and you know what? It could be fixed. It's called insurance reform, and we could have done it before we went home for August, except we chose not to. There are other things in our system that are amenable to being fixed. Certainly the story in Texas with what we've done with liability reform has gone a large way towards increasing the number of doctors in the state and reducing the cost of delivering medical services. There's no question that people need care that's affordable and portable, particularly true in an economy that's on the downturn. People are losing jobs, and their big concern is, well, if I lose my job and I lose my insurance, where will I get coverage? We could help make that coverage available. We could help, again, with insurance reform. Some people might need some additional help with tax credits. All of those things are within our purview. They're available to us to do today. They don't break the piggy bank in order to do them, and they provide more coverage for more Americans, again, without turning over an additional segment of the American economy to the federal government, because goodness knows we've taken on enough in the past 8 months.